I'm Dr. Charles from PHI Preventive Health Institute, and today we are talking about pain medicines used for gout and joint pains and how they are used can either protect you or quietly harm your kidneys over time. There is a way this often plays out. A sudden attack begins in the joint, usually the big toe. The pain is sharp, the swelling is intense, and walking becomes difficult. Pain medication is taken, the pain settles, and life continues until it happens again. Over time, a pattern begins to form. Pain occurs, medication is used, relief follows, and then the attacks return. But this is where the misunderstanding begins. Most pain medicines used for gout and joint pain are not harmless when used repeatedly or incorrectly. They are not just pain tablets. They are drugs that affect inflammation, blood flow, and kidney function. And that is the system we need to understand. Pain in gout and joint disease is driven by inflammation, which is why common medications include NSAIDs such as diclofenac, ibuprofen, and naproxen. These drugs reduce inflammation quickly and bring relief. In acute gout attacks, colchicine may also be used to control the inflammatory response. But here is the key point. These medications are processed through the kidneys, and that is where the risk begins. When used correctly, for short periods and at the right dose, they are effective. However, when used repeatedly in high doses or without proper guidance, the system becomes strained. Frequent use of NSAIDs can reduce blood flow to the kidneys, leading to stress and, over time, possible kidney damage. There is another layer to this. Many patients treat every episode of joint pain as the same, so they repeat painkillers again and again without realizing that not all joint pain is the same condition, not all attacks require the same medication, and not all repeated use is safe. This is how silent harm begins to build. The first risk is to the kidneys. Long-term or frequent use of anti-inflammatory pain medicines can reduce kidney perfusion and gradually contribute to kidney dysfunction, especially in vulnerable individuals. The second risk is masking the real disease pattern. The pain improves, but the underlying issue, such as high uric acid or ongoing inflammation, is not controlled, so attacks keep returning. The third risk is misuse. This includes doubling doses when pain is severe, mixing multiple NSAIDs together, or taking them longer than prescribed. These patterns increase toxicity without improving control. Now step back and look at the system. Gout and joint pain are not just about pain signals. They involve inflammation control, uric acid balance, kidney function, and safe medication use working together. Treatment, therefore, is not simply about taking something for pain. It is structured, timed, and specific. It includes short-term control for pain, long-term strategies to prevent recurrence, and protection of kidney function throughout. When this system is respected, outcomes improve. But when medication is used casually, the cycle continues and complications increase. So the key message is simple. Pain relief alone is not the goal. Safe pain control is. And safe control means using the right drug at the right time for the right duration under proper guidance. The final point is this. If joint pain keeps returning and you continue to rely on painkillers, it is no longer just a pain issue. It is a pattern that needs proper evaluation. Repeated, uncontrolled use can silently affect the kidneys long before symptoms appear. Need guidance? Contact your doctor for proper evaluation or call or WhatsApp +233 20872 0347